Module 13, Long-Term Care Patient/Resident, Part 1. The purpose of this unit is to introduce the student to the basic structure of the body and to review the effect of aging on body structure and function. Common physical and psychological conditions found in elderly patients are presented along with approaches to care. Community resources commonly available to assist elderly patients with their psychological, recreational, and social needs are presented. Hello, CNA students. Let's be honest, Module 13 is a giant module with 290 vocabulary terms. In order to study and understand Module 13 effectively, we need to understand that the vocabulary terms are well organized into specific parts and systems. To help you, we now have broken down Module 13 into 4 distinctive parts. For Module 13, Part 1, we are studying long-term care resident, key vocabulary, medical and anatomical terms, and the nervous system. 1. Nervous system. What it is, the body's control center that sends messages throughout the body. Main function controls all body activities, including movement, thinking, and feeling. Key parts. Brain controls thinking, memory, and body functions. Spinal cord carries messages between brain and body. Nerves carry signals to and from different body parts. Important for CNAs. Watch for changes in mental status, confusion, alertness. Report seizures, dizziness, or weakness immediately. Help protect patients who have nerve damage or paralysis. Okay, now get ready to learn by pronouncing each of the following vocabulary terms, as well as listening to the sentences for each term in context. Are you ready? Okay, let's do this.
Module 13, Long-Term Care Patient/Resident, Part 1. The purpose of this unit is to introduce the student to the basic structure of the body and to review the effect of aging on body structure and function. Common physical and psychological conditions found in elderly patients are presented along with approaches to care. Community resources commonly available to assist elderly patients with their psychological, recreational, and social needs are presented. Performance standards objectives define key terminology. Long-term care resident. 1. Acute. 2. Assisted living. 3. Chronic. 4. Debilitating. 5. Dementia. 6. Long-term care. 7. Reality orientation. 8. Reminiscing. 9. Patient/residence. 10. Skilled nursing facility. 11. Subacute care. 12. Validation therapy. Medical and anatomical terms. 13. Anatomic position. 14. Anatomy. 15. Anterior. 16. Cells. 17. Connective tissue. 18. Contractures. 19. Disease. 20. Distal. 21. Epithelial tissue. 22. Health. 23. Inferior. 24. Joints. 25. Lateral. 26. Membranes. 27. Muscle tissue. 28. Nerve tissue. 29. Organ. 30. Peritoneum. 31. Physiology. 32. Posterior. 33. Prefix. 34. Proximal. 35. Suffix. 36. Superior. 37. System. 38. Traction. Nervous system. 39. Age-related macular degeneration, AMD. 40. Agitated. 41. Alzheimer's disease. 42. Aphasia. 43. Autonomic dysreflexia. 44. Bipolar disorder. 45. Brain. 46. Cataract. 47. Catastrophic reaction. 48. Cerebral palsy. 49. Cerebral vascular accident, CVA. 50. Concussion. 51. Confusion. 52. Delirium. 53. Delusion. 54. Dementia. 55. Developmentally disabled. 56. Disruptive behavior. 57. Elopement. 58. Epilepsy. 59. Generalized anxiety. 60. Glaucoma. 61. Hallucination. 62. Hemianopsia. 63. Hemiplegia. 64. Multiple sclerosis. 65. Nerve. 66. Neuron. 67. Otosclerosis. 68. Panic disorder. 69. Paralysis. 70. Paranoia. 71. Paranoid schizophrenia. 72. Paraplegia. 73. Parkinson's disease. 74. Peripheral nervous system. 75. Post-traumatic stress syndrome. 76. Quadriplegia. 77. Reality orientation. 78. Seizure. 79. 80. Sundowner syndrome. 81. Transient ischemic attack, TI. 82. Tremor. 83. Vertigo. CNA California Exam Vocabulary Sentences for Module 13, Part 1. Long-term care resident terms. An acute illness is severe and requires immediate medical attention. Many elderly people live in assisted living facilities that provide some care while allowing them to maintain independence. Diabetes is a chronic condition that lasts for a long time and requires ongoing management. Arthritis can be debilitating, making it difficult for patients to perform daily activities. Dementia causes memory loss and affects a person's ability to think clearly. Long-term care facilities provide 24-hour nursing services for residents who cannot care for themselves. Reality orientation helps confused residents remember the date, time, and where they are. Reminiscing about happy memories from the past can improve a resident's mood. All patients or residents deserve respectful and compassionate care. A skilled nursing facility provides rehabilitation services and medical care for residents. Subacute care is appropriate for patients who need more care than at home, but less than in a hospital. Validation therapy involves agreeing with residents to help them feel better about themselves. Medical and anatomical terms. The anatomic position shows the body standing upright with arms at the sides and palms facing forward. Anatomy is the study of the structure of the human body. The anterior part of the body is the front side. Cells are the basic building blocks of all living things. Connective tissue holds organs and other body parts together. Contractures occur when muscles become permanently shortened, limiting joint movement. Disease is an abnormal change in the body that causes specific signs and symptoms. The distal end of the arm is farther from the body's center, like the fingers. Epithelial tissue covers body surfaces and lines body cavities. Health is a state of physical, mental, and social well-being. The inferior part of the body is located below another part toward the feet. Joints are connections between bones that allow movement. Lateral means away from the body's midline toward the side. Membranes are thin sheets of tissue that line body cavities. Muscle tissue has the ability to contract and cause body movement. Nerve tissue carries electrical signals throughout the body. An organ is made up of different tissues working together, like the heart or lungs. The peritoneum is a membrane that lines the abdominal cavity. Physiology is the study of how the body functions. The posterior part of the body is the backside. A prefix is added to the beginning of a word to change its meaning. The proximal end of the arm is closer to the body's center, like the shoulder. A suffix is added to the end of a word to change its meaning. The superior part of the body is located above another part toward the head. A system is a group of organs working together, like the respiratory system. Traction involves pulling or stretching to align bones or relieve pressure. Nervous system terms. Age-related macular degeneration, AMD, causes vision loss in the center of the visual field. An agitated resident may be restless, anxious, or upset. Alzheimer's disease is a progressive brain disorder that causes memory loss and confusion. Aphasia is the loss of ability to communicate through speech, writing, or signs. Autonomic dysreflexia is a dangerous condition that causes extremely high blood pressure. Bipolar disorder causes extreme mood swings from depression to mania. The brain controls all body functions and houses consciousness and memory. A cataract causes clouding of the eye's lens, making vision blurry. A catastrophic reaction is an unpredictable, violent outburst from a person with dementia. Cerebral palsy affects movement and posture due to brain damage before birth. A cerebral vascular accident, CVA, or stroke occurs when blood flow to the brain is blocked. A concussion is a brain injury caused by a blow to the head. Confusion means being disoriented about time, place, or identity. Delirium is a sudden change in attention, perception, and thinking ability. A delusion is a false belief that seems real to the person experiencing it. Dementia causes a gradual decline in memory and thinking abilities. A developmentally disabled person has intellectual functioning below average. Disruptive behavior disturbs others and interferes with care activities. Elopement occurs when a resident leaves the facility without permission. Epilepsy is a brain disorder that causes seizures. Generalized anxiety creates feelings of worry and fear without a specific cause. Glaucoma increases eye pressure and can lead to blindness if untreated. A hallucination involves seeing, hearing, or feeling things that are not really there. Hemianopsia is the loss of vision in half of both visual fields. Hemiplegia is paralysis of one side of the body. Multiple sclerosis is a disease that damages the nervous system progressively. A nerve carries electrical signals between the brain and body parts. A neuron is a nerve cell that processes and transmits information. Otosclerosis causes hearing loss due to abnormal bone growth in the ear. Panic disorder causes sudden, intense episodes of fear and anxiety. Paralysis is the loss of movement and feeling in part of the body. Paranoia involves unrealistic feelings of persecution or suspicion. Paranoid schizophrenia is a mental disorder with delusions and hallucinations. Paraplegia is paralysis of both legs and sometimes the lower trunk. Parkinson's disease causes tremors, stiffness, and difficulty with movement. The peripheral nervous system includes nerves outside the brain and spinal cord. Post-traumatic stress syndrome develops after experiencing a traumatic event. Quadriplegia is paralysis of all four limbs. Reality orientation helps residents stay connected to the present time and place. A seizure involves involuntary shaking and jerking of the body. A stroke occurs when blood supply to part of the brain is interrupted. Sundowner syndrome causes increased confusion and agitation in the evening. A transient ischemic attack, TIA, is a mini-stroke with temporary symptoms. A tremor is involuntary shaking, especially of the hands. Vertigo creates a spinning sensation and dizziness.